You talked about how, as a health provider, a true artist in our work, we can't just look at the lab test or the special test, etc. We have to look at the body as a whole, the individual as a whole. And that's where, when it comes to musculoskeletal, a physical therapist should be the musculoskeletal expert. We should be able to look at and extrapolate if here's where the issue is. For example, osteoarthritis in the knee. Notice I said osteoarthritis, not some of the other arthritises.
Right.
But in my mind, that's because of a change in tensegrity. The joint isn't loading the way it's supposed to, and that led to the osteoarthritis. So when I see these diagnoses that are more medical diagnoses, my next question is, but why? Why did that happen in the first place? And can I work back and kind of figure that out? It's like when your light goes on your dashboard to say that you have low tire pressure. What some healthcare providers would do, assuming the dashboard light is pain, is they'll just stick tape over it. In my mind, oftentimes, that's what pain medication is we're just sticking some tape over that light. The next step, though, is, okay, that light is on, but why? It's on because your tire pressure is low. And then you ask yourself, why is the tire pressure low? Is it because it's sub-zero outside, and so the air is just decreased? Or is it because you have a hole in the tire? And where I used to be as a physical therapist, and where, in my opinion, a lot of PTs are aiming towards, because our healthcare system is set up to aim towards this, is, okay, let's put air in the tire. Let's get to where they're not in pain, where they can live their functional life. And that's where it stops. That's where the standard of care stops. But myself, and not having to deal with the insurance side of things and working for my patient instead of insurance, I get to say, okay, but why is that hole there in the first place? Yeah. Is it because the tires need rotated? Is it because your lifestyle is akin to driving over a road with nails all the time, and we've got to change some lifestyle stuff? So that's where I try to focus, and that's one of the ways that I'm able to provide the kind of education that you guys are so big on providing with your podcast.